it on now?
Yeah.
All right, great. Well, it's a pleasure to be here. Always an exciting opportunity to talk to colleagues and you all, particularly now. I believe this will be my second or third engagement with this group, and it's always been a great opportunity and exciting to be part of it. So I think that Dr. Wojciech, her last slide talked about finances and how that kind of segues into what I'm going to talk about in clinical trials, even though my focus here is on diversity and inclusion. But as a way, just to add to our last slide is, for most of us in practice, in clinical practice, adopting or implementing clinical trials, is actually a way to potentially make it more financially worthwhile and potentially also decrease burnout, where you're getting more value for a case that you're handling. But let's go straight into it. So my topic today is diversity and inclusion in clinical trials, encouraging minority participation for health equity. Now, there's something, what obviously connects us all is our background, our ancestry. And what that also means is, when medications or devices are being developed, to what extent do we contribute to the data that lead to those medications or devices? That is really a question that we're trying to answer today. And as we go through these slides, we will take them one by one. So our objectives today will be to define and understand clinical trials, evaluate the demographic consequence in clinical research, understand why diversity in clinical trials is critical, and review roles in ensuring inclusion in clinical trials. Being clinicians and providers, I guess to that extent, we have some understanding of how research works. Clinical trials essentially are research that uses volunteers to test for specific medical interventions, devices, therapies, and primarily testing for their safety and efficacy, especially at the early stages of these trials. These processes are done to understand if a new product is safe and effective, to understand if an approved product or treatment or medication can be used in a different way, or to also understand if approved treatments or medications or devices can be used in populations that have not been tested. For example, approved medication devices in adults now being tested for children. What really comes to mind in recent times, obviously, will be COVID vaccines. How during the pandemic, the whole world had to stop, but it still required, testing, at least in the early phases of certain of these mRNA vaccines, for them to be rapidly deployed and hopefully save millions of lives. But going back to a specific example, for example, the influenza vaccine has been there. A 10-year analysis actually showed that there was almost a 25% reduction in mortality by just implementing the flu vaccines that we may or may not really understand the impact of why we do some of the things that we do. But that being said, it's obviously an important thing that medications like vaccines are being trialed, and that when they are trialed, the participants are reflective of a diverse community, a diverse group, all genders, whichever way they come in. Now, on this slide, I'm going to talk real quick about just the phases of trials. Again, I'm sure most of you already know these. Phase one, generally looking at safety and efficacy. Typically, a small cohort of patients or volunteers are used in these phases, about 20 to 80 people. Phase two still looks also at safety. Pretty much all phases look at safety, but in this case, more also the effectiveness of the therapy. And then phase three then includes much larger population, and it needs the data collected at this point is what then leads to the FDA application for a new drug. Now, clinical trials are conducted according to a plan typically called a protocol.